The World Health Organization, WHO, has recently revised its list of essential medicines, which includes 24 medications for adults and 12 for children. The process of selecting these drugs was based on several factors, including the prevalence of the disease, evidence of efficacy and safety, and comparative cost-effectiveness. The list now comprises treatments for ailments such as multiple sclerosis, Ebola, and various forms of cancer. Recently added drugs like cladribine, glatiramer, and rituximab have been given priority over on-label alternatives for MS patients. In addition, the WHO has introduced polypills, fixed-dose combinations of multiple medicines, including aspirin, statins for cholesterol reduction, blood pressure-lowering medications, and drugs that regulate heartbeat. Nonetheless, anti-obesity medications did not make the cut. American researchers suggested adding GLP-1 receptor agonists for insulin stimulation, which facilitate insulin release. More infectious disease and cancer drugs have been suggested for inclusion. Over 150 countries utilize the WHO model list to ascertain the most cost-effective medications based on health impact and evidence.